When taking action is the trap in EPPP exam questions. Some wrong EPPP answers feel right because they sound decisive. They give the psychologist something to do, and this can feel reassuring when the question describes distress, conflict, impairment, or uncertainty. The trap is that the wrong answers may take action based on facts the question has not actually established. A useful way to catch this error is to think in terms of an action threshold. An action threshold is the amount and type of information needed before a psychologist can justify a particular step. Early information gathering steps usually have a lower threshold. Asking follow-up questions, reviewing records, obtaining collateral information, consulting about an unclear issue, or assessing risk may be appropriate because those steps help determine what is happening. More consequential actions have a higher threshold. Starting a specific treatment protocol, making a diagnostic conclusion, breaching confidentiality, recommending a placement change, or advising a client to take a major interpersonal or occupational action requires stronger support from information provided in the question. This is where wrong answers become tempting. They sound clinically engaged because they respond to the concern. The reasoning problem is that they treat a possibility as though it has already been established. For example, a client reports irritability, poor sleep, increased energy, and conflict at work. A tempting answer may move directly into treatment for bipolar disorder. That answer feels plausible because the symptoms point toward a mood-related concern. The stronger first step is to clarify duration, severity, impairment, substance use, medical factors, medication effects, history of mood episodes, and risk. The question has provided warning signs, not a completed diagnostic picture. Treating the label before clarifying the pattern moves beyond the available evidence. The same trap may appear in risk questions. Suppose a client makes an angry comment about wanting someone to pay for what they did. A more dramatic answer may recommend warning another person immediately. That action sounds protective, and in some situations, protective action may be required. The question is whether the threshold has been met. The psychologist would need to assess intent, plan, means identifiability of a potential target, imminence, history of violence, access to weapons, and the relevant legal requirements in that jurisdiction. Information in the question signals possible risk, and possible risk calls for assessment. It does not automatically establish that the psychologist has enough information to breach confidentiality or take a specific protective action. This pattern also appears in school, workplace, and family scenarios. A parent reports that a child is inattentive in class, and an answer recommends academic accommodations immediately. A supervisor describes an employee as difficult, and an answer recommends a workplace intervention. A partner reports relationship conflict, and an answer recommends a specific communication strategy. Each recommendation may become appropriate later. The EPPP often tests whether the psychologist has enough information to understand the referral question, the client's role, the setting, the relevant stakeholders, and the limits of the psychologist's authority before making a recommendation. To catch this trap, ask what the answer assumes. Does it assume a diagnosis? Does it assume imminent risk? Does it assume the client's goal? Does it assume the cause of the problem? Does it assume the psychologist has the authority to make a decision? Does it assume that consultation, consent, collateral information, or additional assessment has already happened? This reasoning works because many EPPP answer choices differ by timing rather than by general clinical value. A referral may be appropriate after clarifying the concern. A treatment plan may be appropriate after assessment. A report may be appropriate after a legal threshold is met. A recommendation may be appropriate after the psychologist has enough data to support it. The wrong answer may describe a reasonable later step. The correct answer identifies the step that is justified now. The exam is not asking you to be passive. If the question establishes imminent danger, safety comes first. If the question clearly describes a mandated reporting situation, action is required. If the question provides enough information to support a specific intervention, the active answer may be correct. The issue is whether the action fits the evidence already provided. The reasoning rule is to test the answer against the information provided in the question before relying on your clinical instincts. Ask what would have to be true for the answer to be justified, Then check whether the question actually established those facts. If the answer depends on information that is missing, it is probably moving too fast. On the EPPP, an answer can feel responsible and still be wrong when it recommends action before the information provided in question has established enough facts to justify that action.